Three, two, one. Good morning. I'm Steve Wood, Chief Facilities Officer at Ohio University and facilitator for this morning's event. First, we are sorry for the delay. We had an overwhelming participation response that contributed to technical difficulties experienced this morning. Thank you for bearing with us. Also, thank you for joining us today for this employee town hall meeting. As we look to the new school year, we realize that many faculty and staff have questions about how Ohio University is planning for a safe resumption of campus activity. During the spring, the university assembled 8 work groups of faculty and staff members to examine various aspects of a safe reopening, including public health planning, personal protective equipment planning and procurement, academic scenario planning, student experience and student life, academic policy and process, research and creative activity, clinicals, practica, and internships, and back to work safely. These work groups were each led by 2 co-chairs, including deans, faculty, and other university leaders. These co-chairs, together with the chairs of all 5 university senates and senior leaders of several key functional areas, comprised a coordinating council that met weekly for this planning effort. After careful research and discussion, these work groups drafted recommendations that were coordinated and combined into a final report that was submitted to and approved by President Nellis on June 19th. The comprehensive report and all work group recommendations are available on the university's coronavirus response website for your review. There is also a link to the website to submit comments and questions. Some of the questions you will hear answered today come from your questions submitted to that website. The questions we received fall into approximately 7 general areas that our panel will discuss. I'd like to introduce the other panelists today. President M. Duane Nellis, Executive Vice President and Provost Elizabeth Sayers, Executive Dean of Regional Higher Education Nicole Pennington, and Dr. James Gaskell, Health Commissioner and Medical Director of Athens City County Health Department. As we start, Dr. Nellis would like to make some brief remarks.
Well, thank you, Steve, and thanks to all of our panelists for being part of this town hall event, and also to all of you. Thank you for tuning in as we continue to make progress in our planning efforts overall relative to fall. I'd like to thank the students, faculty, and staff who've served on the planning committees. The committees included representation from students, faculty, and staff from across our university community, as well as local public health leaders. Leaders from our 5 university senates have all played key roles in creating the recommendations, and I'm thankful for their continued input in this process. Working together, the dedicated individuals on these committees have provided a very strong plan to help Ohio University move forward in a responsible manner. This has been a very difficult and challenging time for our university, and we appreciate your thoughtful and careful work. I'm looking forward to discussing our plans for fall semester in more detail with you all today. Before we begin, I'd like to say that while we have a lot to discuss right now, we're still working on many details to complete our plans for fall semester. The planning committees have worked very hard to provide thoughtful guidance for a wide range of issues, but this is truly an ongoing effort. Our planning groups will continue to research the situation, study the most available data, and work together throughout the summer to develop additional recommendations and solidify our plans. The safety of our students, faculty, and staff is our top priority, and I appreciate the hard work that so many people have put into building these plans together. The fall semester will be unlike any other fall semester before at Ohio University in so many ways. At the same time, though, we will continue providing our students with outstanding educational opportunities, thanks to the work of all of you. So thank you for your patience and for adapting to the needed changes as we continue to move forward. I'd also like to thank everyone who submitted questions for today's events, and we'll get to those here in just a short time. But I'd now like to introduce Dr. Gaskell, who will briefly discuss public health tactics such as mask wearing and hand sanitizing. Dr. Gaskell?
Good morning, and thank you, President Nellis. I'm going to talk to you about the pillars of coronavirus infection prevention. These pillars of prevention were discussed by Dr. Atul Gawande in an article in the New Yorker magazine, May 13th of this year. Dr. Gawande is well known to many of you. He's a native of Athens, Ohio, and a surgeon at Boston, Massachusetts Hospital. He's published numerous articles in the New Yorker magazine and also has published two books, Complications and Being Mortal. Dr. Gawande reports that wearing face coverings and social distancing seem to be the most important of the strategies available to us to prevent this disease. Most coronavirus infections occur from droplets and mist during interaction with coronavirus-infected individuals. There is increasing evidence that masks prevent disease. N95 masks are used by first responders and medical personnel. They prevent bacteria and viruses from being expelled into the environment by the wearer and prevent infectious agents from entering the respiratory system of the wearer. And when they are fitted properly, they are 100% effective. They are the gold standard of masks. And I have one here. This is what an N95 looks like. And they're used by hospital personnel primarily. Surgical masks, which are the light blue masks that you see in people wearing, they prevent delivery of virus into the environment from the individual 98% effectively and protect the wearer about 75% of the time. They are made of polypropylene fiber. They are 3 layers. The outside and the inside layer are waterproof. When everyone wears surgical masks, infection is mitigated 98% of the time. Surgical masks can be washed once or twice before they are damaged. And this is a surgical mask. They have the light blue covering outside. Homemade masks are widely available also. They are made of 2 or 3 ply cotton, and they're attractive, colorful, and they can be washed repeatedly, so they're very popular. They are about 60% effective in preventing disease, and this is a homemade mask, my own colorful homemade masks. And they're homemade masks I've seen about with the Bobcat emblem on them. They're Bobcat masks. So masks are really important, and that's the reason I talked about them first. Social distancing is nearly as important as masking. Studies have shown that droplets produced by an ill coughing patient will not travel more than 6 feet. So we have to distance ourselves 6 feet from one another. Clearly, masking and social distancing have become very important because of the recognition of the asymptomatic carrier of the coronavirus. Symptomatic people stay home, they're ill, but the asymptomatic carrier is unrecognizable. And the incidence of the asymptomatic carrier in the overall population is unknown. We know that in the prison population, the incidence of the asymptomatic carrier is about 30 or 40%, but that's a closed environment. Because the coronavirus survives on soft surfaces like cardboard for 24 hours and hard surfaces for 3 to 5 days, frequent hygienic measures like hand washing are recommended. We often pass the organism from our hands to our mucous membranes where it's easily absorbed, and then we become infected. So studies have shown that if you wash your hands 5 times daily, you reduce your chances of acquiring a respiratory illness by 45%. So we recommend washing your hands for 20 seconds, sing happy birthday twice, at least 5 times daily. If soap and water, which is really the best, is unavailable, use hand sanitizer with alcohol greater than 60% concentration. Clean your high-touch surfaces with disinfection wipes or solutions frequently. Avoid crowds of people. The duration of time spent with an infected person is important. One study demonstrated that only 2 out of 445 people became infected when an infected person spent only 10 minutes within 6 feet of them. A person interacting with an infected coronavirus patient is required to spend 15 minutes within 6 feet of them before they are considered a contact. And if they are a contact, then they are quarantined for 2 weeks. So 15 minutes within 6 feet of them makes you a contact. When dining in restaurants, try to dine outside. Outdoor activities are safer. So my message to you is wear your mask with pride. You are preventing disease in your neighbor, your family, your loved ones, and perhaps yourself. You are saving lives. And if we all wear masks and social distance, we can keep the incidence of infection low in Athens County until we have developed a vaccine, which will halt the pandemic. Thank you.
Thank you, Dr. Gaskell. We'll now turn to the questions. President Nellis, what ability do faculty and staff have to choose to continue to work remotely or teach remotely this fall?
Yeah, thank you, Steve. The planning committees recommend reducing campus density wherever possible. Faculty, staff, and graduate students, while in teaching responsibilities, should have received a memo yesterday evening from Provost Sayers outlining planning and requesting information related to their unique assignments and efforts to accommodate their special needs. Faculty and staff with teaching responsibilities will need to follow the provost guidelines, and all staff will need to also communicate their individual situations with their supervisors to determine if they're working remotely on their campuses or partially remotely. We certainly want to be sensitive to accommodate those faculty and staff who have special circumstances, and where possible, work in administrative and academic support, maintenance of campus systems, and related duties should occur as much as possible in remote modality to reduce density.
Thank you, President Nellis. Provost Sayers, next question is for you. How will employees who are in high-risk category or have family members who are receive accommodation?
Thanks, Steve. I know that is a question that has really been at the top of many people's minds, and I'll elaborate on some of the processes that Dr. Nellis just mentioned. And I'll start talking about faculty, but I'll also talk about staff. Last night, I sent an email to all instructors that we're defining as faculty, graduate students, or staff who have teaching responsibilities in the fall that really outline that process that instructors can use to request alternative teaching arrangements for the fall semester. And basically, there will be an online form that those instructors can fill out. And through that form, they can request alternative teaching arrangements such as remote or hybrid teaching modalities, additional personal protective equipment, or modifications to the classroom environment. Since mid-May, chairs and directors have been working with their faculty and with the Academic Scenario and Curriculum Planning Work Group to identify which courses should remain face-to-face to meet their learning outcomes, but also which could be effectively taught in hybrid or remote modalities. So this request process, will help departments and colleges incorporate any alternative teaching arrangements into that work as they finalize their fall planning. There are 3 categories under which an instructor can make a request for alternative teaching arrangements through that online form. First, if you're a person with a disability, if so, you'll work with the Office of University Accessibility to identify and implement any reasonable accommodations to assist with your teaching responsibilities. And Ohio University, as we do under normal times, will provide reasonable accommodation as required by the Americans with Disabilities Act. Secondly, we also want to support instructors who may not have a medical condition or disability that really rises to the level of reasonable accommodation for disabilities, but nevertheless have factors that put them at increased risk of severe illness from COVID-19, according to the Centers for Disease Control, or the CDC. The CDC recently updated its guidance for people who should take extra precautions during this pandemic because they are at increased risk of severe illness. So if you're an instructor who is at or might be at increased risk of severe illness, or if a member of your household is or might be at increased risk, you may request alternative teaching arrangements through that online form. Some of the additional risk factors identified by the CDC include things like age, and many chronic underlying medical conditions. The third category, finally, is if you're an instructor who does not fit into those first 2 categories, but you have other COVID-19 related concerns, such as being a caretaker of a person who is not a member of your household but is still at increased risk, or if you have child or other dependent care concerns, for example, you can also request alternative teaching arrangements through that online form. That information will be shared with chairs and directors and colleges as they determine which classes can safely be taught face-to-face and which will be taught in hybrid or remote modalities. No specific health information is collected on that form or will be shared with directors, chairs, or colleges. Our goal is really to balance the instructional needs of the departments with the instructors' needs while providing a high-quality education to our students and protecting the safety of our faculty, staff, and students. We believe that given our space constraints under current guidance for safe physical distancing, we will need to have instructors who are willing to teach remotely in the fall. This online form will help match instructor needs and preferences with departmental needs. Staff who are not faculty, who are at increased risk but don't qualify as having a disability under the Americans with Disabilities Act, such as those individuals with the increased risk factors that I just mentioned, or who live in a household or are caregivers for people at high risk, should talk with their supervisor or their human resource liaison to really talk about their possible options. As Dr. Nellis mentioned, the recommendations of the Back to Work Safely group included recommendations that employees who can complete the duties and responsibilities of their positions remotely should continue to work remotely where possible. By reducing overall density of people on our campuses, we can reduce the risk of transmission to those employees who must be on campus, and we can reduce the risk of exposing our students to the virus. Finally, in order to ensure our educational continuity, it's important to have faculty and staff who can step in when a colleague becomes ill. If for staff, having staggered shifts or alternating days on campus, and overall fewer people on campus support safety and continuity. In order to meet our students' needs, especially during this time, we'll have to figure out new ways of supporting them. For example, in academic support services, many areas are expanding virtual meetings with students, virtual drop-in hours, or increased self-service options, while reserving in-person meetings for when it is critically important to be face-to-face and when it can be done as safely as possible. We know that our students are technologically savvy, so meeting them in their online space is a good option. The key is accessibility of information and timeliness of our support, regardless of the modality. In some circumstances, alternative teaching arrangements or alternative working arrangements may not be possible. Depending on the circumstances, faculty and staff can also consider potential leave options, such as FMLA, the FFCRA, the Families First Coronavirus Response Act leave, or other possible applicable leave options.
Thank you, Provost Sayers. Dean Pennington, how will decisions be made about which courses are taught in person, online, or in a hybrid format, and what authority do the faculty and academic areas have to make those choices?
Thank you, Steve. The Center for Disease Control and Prevention has articulated considerations for institutes of higher education, guiding principles to keep in mind, which include that the more individuals interact with others and the longer that interaction, the higher risk of COVID-19 spread, as Dr. Gaskell indicated. As Ohio University seeks to minimize campus density to prevent spread of infection, we will prioritize space for classes, individual and group learning study activities, and selected co-curricular experiences. We will follow CDC guidelines for our hybrid educational model, including small in-person classes, activities, and events. Individuals will remain spaced at least 6 feet apart and will not share tools. The hybrid virtual and in-person class structures and/or staggered rotated scheduling will help to accommodate smaller class sizes. Department chairs and school directors are working with faculty members to determine the most effective modality for courses, as Dr. Sayers indicated. Most courses larger than 30 students will be delivered in online or hybrid modalities. However, schools and departments may request exemptions if course learning outcomes may not be met without face-to-face instruction. Department chairs and school directors are working with faculty members to determine the most effective modality for courses. Most courses larger than 30, as I indicated, will be delivered online or hybrid modalities. Each Athens College and regional campus has received a list of their fall courses and have been asked to provide an update on the plans for each course and section, including delivery format. College and campus leaders have reached out to departments and faculty to help understand what is required, what is preferred, and what alternatives exist. Decisions about delivery format and instructor assignment should be collaborative, and the information will be reviewed and approved at a college and campus level prior to submission.
Thank you, Dean Pennington. I'm going to take the next few questions myself. The first of which is, who is responsible for keeping campus spaces sanitized and cleaned, and will there be sufficient resources, i.e. personnel and supplies, to do this? In accordance with the CDC and Ohio Department of Health guidance, FMS's approach for cleaning and disinfection of administrative classroom spaces will be a daily cleaning and disinfection of all classrooms and restrooms by our staff of custodial professionals. Additionally, we will provide routine disinfection of high contact surfaces areas within our facilities, especially entrances and lobbies. This is in alignment with some of the suggestions or direction that Dr. Gaskell was providing. Lastly, we will make cleaning products, disinfection wipes, or spray bottles and paper towels available to students and employees to disinfect the spaces and equipment they've used. Use of shared objects, for example, lab equipment, computer equipment, should be limited when possible or disinfected between use. In total, these actions minimize the health risk to the individuals and the campus community. The next question is, how will campus spaces, including classrooms, be modified to ensure proper social distancing? And our approach to ensuring physical distancing in university spaces will vary. We have a lot of different kinds of facilities and classrooms out there. No matter the approach, though, the outcome is to ensure 6-foot distancing between individuals. Actions being undertaken by the university include floor marking for ingress and egress and directional walkways. This will be markings and signage or a combination. Rearranging or removing furniture or seats from the spaces. Blocking off or marking seats to show where individuals can sit. Where applicable, distancing may also be accomplished by varying shifts, continued work from home, and in a few cases, implementation of screens or other physical barriers. For classrooms, implementation efforts included estimating the seating capacity based upon test classroom design and modeling. The modeling has been supported with in-person setups to validate the theories being practiced. These actions enable us to accurately predict classroom capacities and update the university scheduling system. This information will inform communication with academic committees, departments, and others to enable decisions on appropriate instructional modality. Instructional modality options, as previously described, just include the online, in-person, and hybrid, but additionally could necessitate use of non-traditional classroom space to accommodate needs and use of temporary structures as needed where Ohio space doesn't accommodate the recommended safety protocols. We're even investigating at this time the possibility of using an exterior tent. The last question I have is, what is being done to ensure adequate ventilation in our spaces? So in accordance with recommendations from the American Society of Heating, Refrigeration, and Air Conditioning Engineers, or ASHRAE, Facilities Management and Safety is actively engaged in adjusting our systems at both the main and regional campuses to maximize the use of outside air or improve the air quality. Additionally, we've taken actions to ensure heating, ventilation, air conditioning filters have been upgraded to MERV 13. This is a measure of the amount of particles that can pass through a filter. While ASHRAE recommends these actions, they also share that the basic principles of social distancing, surface cleaning, disinfection, hand washing, and other strategies of good hygiene are far more important than anything related to the HVAC system at preventing the spread of the disease. Provost Sayers, what is being done to ensure the appropriate technology to handle remote instruction is in place? Provost Sayers, I think you're muted.
My apologies. In March, we really had to make that swift decision to move our entire curriculum online in a matter of days. And our faculty and our staff really rose to that occasion. And we were able to finish the semester really meeting those educational outcomes for our classes and for our students. But preparing to teach online or in a hybrid modality is a significant undertaking, not just in technology, but also in preparation. So we've increased the number of resources that are available to support faculty as they continue to prepare for the fall. The Office of Instructional Innovation has expanded its summer workshop series to include both basic and more advanced remote teaching support, as well as individual faculty consultations. In the spirit of using multiple modalities, some of those workshop materials are available asynchronously on the Keep Teaching website, ohio.edu/keep-teaching. And some learning opportunities for instructors are available through scheduled workshops, but some of which you don't even need to do advanced registration. And we'll continue to add and adjust resources throughout the summer because circumstances are quite fluid right now. The university is also procuring webcams and boundary microphones that can be used with Microsoft Teams or other conferencing software to facilitate teaching and virtual student engagement in classrooms and in learning spaces, including some of the non-traditional learning spaces that Steve just mentioned, whether it's dining halls or conference or event spaces or even outdoors. We have a limited number of portable displays that can be deployed to non-traditional spaces as needed as well. We're also partnering with the library and instructional innovation to deliver a series of faculty workshops to help them select the best tools and really understand what's available through the library as they prepare for their specific instructional needs and for a remote close to the semester. I should add that there are also resources to help staff improve their remote work strategies at the Keep Working website, which is ohio.edu/keep-working. And we'll continue to develop these resources in the coming weeks, as well as to share resources that other institutions have developed, and updates will continue to be posted throughout the summer.
Thank you, Provost Sayers. Dean Pennington, the next is a two-part question. Will returning students be asked to show that they have tested negative for COVID-19 or quarantined for 14 days if traveling from out of state? And how will students be monitored, tested, subjected to contact tracing during the school year?
Thank you, Steve. Students, faculty, and staff will not be asked to show that they have tested negative for COVID-19 or quarantined for 14 days if traveling from out of state. Only those who have traveled internationally will be required to stay home and monitor their health for 14 days. The public health group recommended testing symptomatic and suspected infected individuals using local health care. Contact tracing for anyone testing positive or exposed will be completed by the local health department, and it will be determined if additional testing needs to be completed. The public health group did not recommend mass screening tests or antibody tests at this time, given the current knowledge of disease progression. This position could change if evidence supports either of this type of testing.
Thank you, Dean Pennington. President Nellis, who is responsible for informing students about safe guidelines like mask wearing, hand sanitizing, social distancing, monitoring temperature and symptoms, and how will such public health behaviors be enforced, both on and off campus?
Yeah, thank you, Steve. This answer is discussed in the campus safety section of the fall 2020 recommendations. If you look at the document under coronavirus/fall planning/scenario-recommendations campus safety. You'll see specifics there, but the university administration will help to lead this effort, but it will likely, it will be key, I should say, to have all of our university senates involved and additional constituent groups engaged in this effort. Our planning committees call for all aspects of our university community to be involved in this work in order to operate most effectively. We will prioritize education and training for employees and students to better understand not only the virus, but also the policies and principles to help ensure their safety and continued health, to educate them about preventative measures, and initial actions to be taken if the disease is suspected. This includes various forms of social media and marketing, social norming, peer education training, and health education programs. Also, training materials for students, faculty, staff, student employees, and visitors will be made available. In addition, the university plans at this time to develop an Ohio University Social Compact with adoption by all key groups. And the university will request support and adoption by all of our campuses, not just here in Athens, but across our university umbrella. It will be important to have our university senates engaged and participating in the creation of this compact. The purpose of the social compact is to acknowledge the disruption of COVID-19 and to assist all constituencies on our campuses to strengthen and clarify how we support one another's health, teaching, learning, and creative activity. The university is also working with city leaders, not only here in Athens, but in our extended network. But in Athens, we're looking at an Athens Business Community Compact possibility, an adoption by all key groups such as our Uptown Business Association, our chamber, and we are requesting support and adoption by all. We will engage in similar conversations with local governing bodies, again, in our regional campuses towards the development of similar types of local agreements. Thank you.
Thank you, President Nellis. Provost Sayers, I have a two-part question for you. What will faculty or staff need to do to accommodate sick or quarantined students? And how will the university handle teaching responsibilities if an instructor falls ill?
Thanks. That's a really good question, or two questions. We know that families are going to be concerned about the possible impact on their student if they become ill during the semester. And certainly, if you've taught, you know how challenging it can be to work with students who become ill, or for instructors who become ill during the semester to cover their responsibilities. So for students, in addition to our existing excused absence policies and other existing policies related to medical needs, we've worked with Faculty Senate to make sure that all courses will automatically be available on Blackboard so that it's easier to make materials available online, even for a face-to-face class, in case there are disruptions for the student or for the instructor. We're also working with the Academic Policy and Process Work Group to identify any academic policies that might need to be modified for the coming semester. For example, last spring, we extended flexibility with incomplete deadlines so that if a student couldn't complete a course during semester, they would have extended time to finish the course, earn credit, and continue progress toward their degree. For faculty, we're asking departments to develop contingency plans for course coverage in the event that an instructor falls ill. That's also one of the reasons we're asking instructors to use Blackboard to provide materials to students. So there's a safe and effective way for faculty and students to communicate in the event that they can't meet face-to-face because of illness or quarantine.
Thank you, Provost Sayers. President Nellis, what scale of outbreak will trigger a complete campus closure, and how will the university carry out such a closure?
Thanks, Steve. And we certainly hope that doesn't happen. But the scale of the outbreak will trigger a complete, as you said, what will create that closure? The presence of the disease on campus and in the community will need to be analyzed very, very carefully relative to making decisions related to closure. Ohio University leaders will continue working with state and local health officials as we're required to do, including Dr. Gaskell, throughout the fall semester to monitor the situation. We basically already have daily conversations with Dr. Gaskell and his team, and we appreciate all his support. And as well at the state level as well. So any decisions on campus closures would be made in consultation with the state and local leaders.
Thank you, President Nellis. Dean Pennington, How will university events be handled in the upcoming year, including major events such as commencement, but also anything that is typically held in the Baker Ballroom, Memorial Auditorium, large conference rooms, both at the Athens campus and at the regionals?
We continue to follow the guidance from Governor Mike DeWine and public health experts with regard to planning or hosting in-person events. At this time, all in-person university events are postponed until at least July 6th. Many virtual events like webinars will continue as scheduled. Information on whether events are canceled or rescheduled will be posted as we receive it. In the meantime, please reach out to event organizers for the latest information about specific events. We are very aware that we will need to provide additional guidance about events as the summer progresses and for fall planning. To that end, the Student Experiences Student Life Work Group has identified a smaller implementation team to work specifically on the issue of events and space prioritization. This group includes representatives from university conferences and events, university admissions, culinary, university planning, and other key stakeholders. For the regional campuses, we are again seeking to balance student engagement needs with safety, and will develop a phase-in plan for events on our campuses. On the Athens and regional campuses, we are evaluating the need to use some large event spaces as additional classroom or learning space to ensure safe physical distancing. Finally, given the robust cleaning protocols, we are working together with facilities to phase in use of space to ensure cleaning coverage for our buildings. Additional guidance will be forthcoming.
Thank you, Dean Pennington. This concludes our time today. I want to share on behalf of all of our panelists and the team that is supporting them that, again, apologies for the delayed start and the technical difficulties that occurred. We'd like to thank all those who submitted questions and everyone for joining us this morning. Please note that we will be posting the frequently asked questions to the university website for your further reference and review. For anyone who is not able to attend the town hall meeting, this session has been recorded and will be available to watch at this link after the event. There is additional opportunity for you to comment or to ask questions about our fall reopening plans on our fall planning website.